You will now see a demonstration by Professor Michael Boyne, consultant endocrinologist, of how a patient with diabetes can be examined in a busy clinic.
So I'm Michael Boyne, and I'm going to be doing an examination for a person with diabetes, and we're going to be using Mr. Smith. Mr. Smith, thanks for coming in so we can do this examination. And the first thing that I do when I'm doing an examination is I do a general. So I look at the body mass index. So does the person you look overweight, underweight, obese, grossly obese? As well as I look for secondary features of whether or not they have Cushing syndrome, acromegaly, anything else that could cause the development of diabetes. Anything that looks like in a younger person it could be congenital. Afterwards, I will start to take a look at the skin. The skin is very important in the physical examination of the diabetic person. We're looking for evidence of infections, other sorts of rashes. We're looking at the nails. And we do a general exam of the skin. Also run my hand over the skin, just in case I detect any irregularities. What's very important in the person with diabetes is whether or not they have acanthosis nigricans, which is this darkening over the nape of the neck. Our patient has a little bit of it right here, and we can grade it actually. Some people use 1+, 2+, 3+. I tend to say there's a grade. Grade 1 is just over the nape of the neck. Grade 2, you see it laterally. Grade 3, you see it in the front. And then grade 4, even underneath the breast and under the knuckles. I normally do the skin exam of the feet a little later on. Sir, I'm just taking a look at your eyes. Very good. I'm going to ask you to open your mouth. Stick out your tongue. Very good, and you can close. Then I do a retinal exam. It's very important to have a retinal exam in the person with diabetes. Even though they may actually be seeing an ophthalmologist, we still are obliged to look at the eyes. So I'm first shining the light into your eyes, sir. And with this first cursory, I'm actually looking more for the presence of cataracts. Sir, I'm going to ask you now to look straight ahead at the wall, and I'm going to come very close to you. And so I get a red reflex, and I zoom right in. Our patient does not have any obvious cataracts that I can see. And at this time, I'm taking a look at the optic disc. When they have gross glaucoma, you may detect that, but most of the times I'm looking for microaneurysms, I'm looking for exudates, I'm looking for hemorrhages. Very good. I'm going to go into the other eye. Look straight across again, sir. Coming in, zooming in, taking a look around. And I'm not seeing anything here. Very good. Excellent. Afterwards, I move to a thyroid exam. So for the student's sake, we move to the back of the patient, even though there's a front ways of doing the exam. And at this stage, I'm going to examine the right lobe of the thyroid, then the left lobe. And while I'm here, I'm using opportunity to feel for the other lymph nodes in general. Very good. Mr. Smith, we're going to now ask you to lie down. Just place your head up here. Very good. And you can place your hands at the side. Ideally, we'd have also had a blood pressure, which we're not going to do right now, but we'd have had a blood pressure maybe taken when you came to the clinic, or I'll do it myself. And we want to make sure that there is no digit preference. In other words, all the numbers can't end in 0. Mr. Smith, I'm going to be feeling your pulses. Okay, making sure that they're radial, synchronous, and the radial pulses are synchronous. Very good. I'm going to feel your abdomen. Any problems with the belly? Good. Now, feeling for the abdomen for me is really mostly 2 aspects. One is any masses at all, and 2, whether or not there's any evidence of hepatomegaly. So some deep breaths in and out, sir, and out, in and out, in and out, In and out. Very good. In and out. Very good. Just tapping out for the edge of the liver. Very good. Certainly has nothing below the right costal margin. Sir, just also testing to see if there's any gross hepatomegaly. In and out. And out. And out. Very good. At this stage, we're not so concerned with ascites and renomegaly, but we are very concerned about listening for bruise. So I'll listen over the renal angle, over the aorta, as well as over the left renal angle. Very good. All right. Very good, Mr. Smith. I'm going to ask you just to turn your head to the side. And while I'm here, I'm just also testing to make sure that he has no elevated jugular venous pressure, JVP, but obviously none there. All right. I'll put my hand back on his chest, looking for thrills and heaves. Sir, I'm going to be listening. You can breathe normally. You can just breathe normally. Very good. Very good. So I'm going to ask you to take a deep breath and to hold it. And now to let it all the way out. Very good. And now we can breathe normally. Very good. Excellent. Okay. So far, so good. So at this point, we're going to now examine the lower limbs. This is where I'll do my skin inspection of the lower limbs. Also run my hand along it. It's very common for persons to have dry skin with diabetes, but we're also looking for many other things. We're looking to see, is there any evidence of ulceration? Is there any evidence of fungal infections, especially between the toes? So it's important to check between the toes. Right? Any foreign bodies, which they may not appreciate. Do they have any evidence of sepsis on the skin? Are the nails dysmorphic or have tinea, fungus within them? And at this stage also, we'll also check for the pulses. So I'll check for the dorsalis pedis, which are present, as well as I'll just check for the posterior tibialis. I'll also check to see whether or not there is any edema by pressing over the bony prominences for at least 10 seconds, after which we'll see if there's any indentation there. Not much at all. What's also important to see whether or not the arches of the feet have fallen, so they tend to may have flat feet and therefore change the way they walk, as well as if they may have hammer toes, a sign also of peripheral neuropathy. So testing for peripheral neuropathy, it's important to use a 128 Hertz hammer. Do you feel this vibration, sir? Very good. I'm going to touch you now on your toe. Do you feel it down here? Is it does it feel the same as when I touch you on your wrist? Feels the same. Very good. And here. And here. About the same. Very good. So it's important to compare with the arm to make sure that they can appreciate the similarity of sensation. Now I'm going to do a monofilament test. So this is a 10-gram monofilament. Sir, do you feel when I touch you here? Excellent. I'm going to touch you in 10 spots on your feet. Anytime you feel even the slightest touch, anything at all, say yes. So moving to the foot of the bed, we do it in 10 spots. So here we go. And over here. Yeah. Sure. Yeah. So we do 10 spots, so 1 over the dorsum of the foot, 3 over the heads of the toes, another 3 over the heads of the metatarsals, 2 midfoot, and 1 over the calcaneus. You didn't get all of them, so you got about, I think, 8 out of 10 over here and 6 out of 10 on that foot. Some people may also use soft touch to test for a sensory level. So do you feel me touch you with this, sir? Very good. Now, do you feel me touch you here on the toe? Is it the same as here? Very good. How about here and here? About the same? Right. And if it wasn't the same, then we would have asked to see, we'll try to find a sensory level by comparing further and further. So here and here and here and here, here and here. But in this case, it's not relevant. Very good. Now at this stage, we're also going to do his reflexes, and we're going to have you sit on up, sir. And we're mostly interested in what's going to happen here at the ankle, but I will do knee as well as ankle. All right, so here we go. All right, so he has one there. Very good. And in this case now, so a little slide there. Okay, so he has preserved ankle reflexes, although they're not as vigorous as the knee. So, and that probably will be it for the physical examination. Thank you, Mr. Smith. Okay.
You have just watched a demonstration of how to examine a patient with diabetes. The exam assessed a number of systems, but was particularly focused on assessing key risk factors and complications, particularly end organ damage associated with diabetes. It is important to remember that additional assessments may need to be done depending on your patient's clinical condition.